Welcome to Inconvenient Health. I am Evan Sachs of the Washington Heights and Inwood Mask Block. Today we are joined by Julie Lamb, founder of Mask Together America, and a patient representative for NIH Recover. Welcome, and thank you so much for agreeing to do an interview, Julie.
Thank you, Evans, for having me. My name is Julie Lam. I founded Master Get America in 2020 after a friend who worked at a hospital died of COVID, and I decided to step up and use my experience and skills as a communicator and used to work in advertising as a creative director. So I founded this initiative, which is to raise awareness, to let people know why we have to wear our masks, test before gathering, test negative before leaving isolation when we're sick, and also why we need to clean the air to reduce the risk of infection and transmission. Um, and also sick leave, like we need sick leave, we need people to stay home when they're sick, and we need employers to understand that, to keep the workplace safe and also keep school safe, we need, people who are sick to stay home and isolate until, they are testing negative 48 hours apart twice before going back, so that the virus will stop, with these people, stop the chain of transmission and not spread to all the other people, especially with people who are vulnerable. They can die from the virus, and a lot of people get very sick and develop complications, and later all kinds of chronic illnesses. Because COVID can trigger onset and relapse of chronic illnesses, which we call it long COVID, which is an umbrella term, but that doesn't really explain the mechanism of how the virus can trigger uh, this autonomic dysfunction, immune dysfunction, heart complication, uh, brain damage, impair your brain and like make you unable to remember things or think properly, and also make people really, really, really tired. And the fatigue, I can explain to you as a long hauler. Um, I mean, I got COVID because I trusted the vaccine. I got vaccinated, and then uh, I trusted Dr. Fauci in 2021. Christmas time, I went to see my family and I got infected by a family member. And after that, I truly understand, having my kidneys damaged and triggering, all kinds of chronic illness, including sleep apnea and and Sjogren syndrome, dry eyes, and like super painful and dizziness, and now like also passing out very often. I want to people to understand is long COVID affects all your organ system, and scientists and researchers still don't really know how to treat all these different conditions. And so we really need to work together to prevent the spread, because we don't have FDA approved medication. And one of the things that we need to pay attention to is, since we don't have FDA approved medication, people cannot get insurance coverage on these medication. And I will tell you is very simple thing to understand. When I used to have a mild form of IgA nephropathy, it's an autoimmune disorder that affect my kidneys. before the pandemic, it was stage one. I don't really need any like uh, expensive treatment, just like a drug that lower my blood pressure and control, uh, the function of the uh, kidneys. And I was, nothing changed in my kidneys for years. But after I had COVID, um, and also reacting to the vaccine, my kidney function after the infection dropped 20%. And then that forced me to have to get a medication called Typeo. And the medication is a steroid, and it costs uh, nearly 16,000 a month. 16,000. And my insurance refused to cover it. And so that changed my life. After that, I signed up for a medical trial for an immune modulator. And that's how I learned that COVID can damage your immune system, can affect your underlying condition. And patients like me are also unable to participate in like long COVID trials because of our underlying condition. They outright reject people that already have heart condition or kidney condition, and they don't study people that have underlying condition. Therefore, so as we know, 3/4 or 60% of the adult population actually have medical conditions. So all these people are not included in long COVID trial, and they're being left out from research, and people are not diving deep into how people died from COVID and also long COVID. And this attitude really has to change. And anyway, that's what I want to share with everyone, like what I know of long COVID.
No, that's amazing information. And do you have any idea why folks with pre-existing conditions from before long COVID are excluded? Have you ever heard of a reason why that is right now?
Because they want to understand a pure pathway, like that is not affected by, you know, other potential things like complications. Like they don't know, they want to get very pure data, which is a big mistake in my opinion. I have IgA nephropathy. What my disease is about is I have abnormal IgA1. So these abnormal antibodies will produce when I'm infected with respiratory infection. And these abnormal antibodies, when they get reproduced, like activated, they fight with the good IgA antibodies. And when the two fight together, they create inflammation. So isn't that a clue to how COVID damaged people's organ? Because my organs lost 20% function right away. The blood work showed that. And I've been trying to tell people, you should not exclude patients that have underlying condition, because those are the people that died. And we need to understand how people die. And now a lot of long COVID patients are dying. We suffer for years. And we have to understand is long COVID is like a plate, hot plate. Some people in the center of the plate is burning in the sizzling oil. They are suffering tremendous, devastating conditions. They're bedbound. They 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 have recurring symptoms that's like eating them alive. And then there are, the outer circle. There are people infected by all kinds of variants, including Omicron. initially the symptoms are more mild or more singular. Say people have pain like me initially in 2022. After a few months, I developed eye pain, and the eye pain uh, caused me to feel dizzy. It caused me to I mean, it's like fucking crazy, like falling asleep when I'm behind the wheel driving. And in the middle of a highway, I would have to pull over. I told my husband I cannot go carry on. I need to pull over. I cannot continue to see because I'm really, really tired. Really, like my eye would droop. And that is dangerous, right? But if some of these researchers created the long COVID index, what they did is they have they evaluated 40 symptoms from people participating in surveys, and a lot of these people are very sick, bedbound. So these people have all kinds of symptoms. They check off everything, and then these researchers get the idea that, oh, long COVID means like all of these symptoms happening in the same person, or, and they're all very severe. So therefore, they think that by using some statistic model, they can reduce it down to a smaller list, and then put a lot of weight on loss of taste and smell. And they also put a lot of weight on PEM, which is a severe symptom of ME/CFS. So a lot of people do develop, chronic pain and chronic fatigue, but that's not it. That's not really what happened to a lot of people who have when the symptoms progress, like what happened to me with the eye pain, eventually the pain spread over the years. It progressed because the virus or the remainder of the virus is possible that it's alive in my body, is everywhere, damaging the tissue. Autoimmunity can cause the virus to continue to attack itself with the antibodies attacking the tissues. And the pain, I mean, I'm not a scientist, definitely cannot explain this, without, pulling studies. But I can say is the pain spread. It spread from my eyes, eventually to my neck, to my shoulder, to my back, to my knees, and it damaged my immune system. I paid a lot of money, $1,000, to participate in Bruce Patterson um, research, that they have these testing where you can find out about your immune system, how it was damaged. And it showed that I have very low level of monocyte, which is the signal cells in the immune system. They are damaged by COVID. And I also have very low level of IgA, IgG, and IgM. At the same time, I have very high level of anti-SARS-CoV-2 antibodies. So the anti-SARS-CoV-2 antibodies is really active. It's continuously to rise, continuously to be activated in my body. At the same time, I have immune dysfunction. So I have pain that comes every single night when I lie down. That's when I go to hell. Initially, I remember in 2024 when it started, I went to see all kinds of specialists. So far, after so many years, I've seen over 30 specialists. I've cried in the office. I said, please have mercy. I have this pain that won't go away. But guess what? My pain is not counted in this long COVID index, research index. If you only have pain, you will not be counted as a long COVID patient. And that's what I am very upset about. You cannot tell me that you think long COVID is real when you exclude a lot of patients who have symptoms that does not score enough points in your index. That is not right. Leaving any patient behind is not right. And I suspect we're leaving a huge population behind because I'm also an independent reporter for COVID and long COVID. I have interviewed thousands of people in this pandemic, and many of the people suffer from chronic illnesses after COVID. Some people develop diabetes, some people have asthma. I mean, I'm talking about type 1 diabetes, adults developing type 1 diabetes. That should be detected when they're kids if they have type 1 diabetes. But their pancreas most likely have been damaged. And people develop heart disease and blood clots and brain impairment. And a lot of people develop autoimmune disorders like me, uh, rheumatoid arthritis, lots and lots of pain in their bodies. And some people lost their teeth. Some people develop skin rashes that are also autoimmune reaction. And now they're starting to say that the mechanism is that COVID damaged the kidneys. Oh, right. We know that from the beginning because that's organ damage. Organs have tissues. Our bodies have tissue everywhere. But it's really upsetting, the situation. That's why with your help, Evan, and many other volunteers on our team, we put together the Long COVID Defense Forum and also a Long COVID Defense Guide that talk about the layer approach. We want people to understand what is long COVID. We need people to understand the truth about long COVID and also how long COVID, the prevalence of long COVID is not being measured right now. There's no data. So people cannot keep saying that, oh, this study showed what percentage. You don't trust any of that because we have to first look at how they identify long COVID patients. If they use a stigmatized or minimizing method that only identify, say, the highest bedbound, like, most serious bedbound patients, that is not how long COVID works. You must identify people at all stages of long COVID.
Yeah, and thank you so much for that amazing information. And I will definitely try to link to the series one of the forum in the show notes, which we've already done and had great information from doctors and advocates. One thing that stood out to me is that you mentioned a couple times about eye pain, which is related to Sjogren's, which for those who don't know, Sjogren's. That's related to like basically your eyes and mouth aren't getting the hydration they need from the body. And I had no idea that that could be a resulting complication from long COVID. Uh, um, but that's a problem for you and others, it sounds like.
Yes, I want to add that the diagnosis process is also really weird. So because I don't have, loss of taste and smell, so initially it was really difficult for my team of like providers, like my primary physician, nephrologist, cardiologist, uh, and immunologist, like to understand that this is because of, you know, the lack of uh, clear direction and definition of long COVID, because even if you only have one symptom, you still living with long COVID. And people have to like start to investigate and help the patients and find targeted treatments. Unfortunately, we don't have FDA approved treatment. And so healthcare providers have a hard time prescribing treatment. There are a lot of antivirals out there, and I happen to be lucky or very bad luck. Uh, my husband uh, brought COVID home and infected me in the summer because people are not isolated when they have COVID and they go to work. And so infected my husband. He didn't have any symptoms at all. He's completely asymptomatic, but he tests routinely to protect me because he know that I'm immune deficient because of COVID. So he tested positive and he immediately isolated, and we uh, slept in separate room and stuff and wear masks at home and have like HEPA filter. But still, I caught it and tested positive later. And I had symptoms, and then I recovered because we were taking precautions. So the viral load is probably very, very low, like the what I was infected with. So I did recover from the acute phase. But a few months later, guess what? It triggers shingles. COVID can reactivate herpes zoster virus. And when I went to see my doctor said, uh, prescribed me with the medication that treat shingles. So I want to like go back to explain this. I was vaccinated for shingles. Actually had like really severe reaction, but so I definitely have antibodies to protect me. And I also had chickenpox when I was a kid. So this should not happen. But COVID is opportunistic, as Dr. Cawthorne told us. COVID know how to make people sick. So it reactivated the herpes zoster virus, and it gave me a chance to understand how COVID, work and sicken other people, as well as myself. I'm always very curious, even though I'm not a scientist, I'm very into understanding the mechanism of how COVID spread and also how COVID infect people and how COVID like trigger these chronic illnesses. It does reactivate uh, dormant viruses, and it also reactivate dormant cancer cells. And that's how people who have cancer on remission, if they got COVID, it can very well trigger, the inflammation can trigger the cells to reactivate and then can spread. I don't know how my father and my father's wife, the two of them, passed away in this pandemic. It's a it's a really serious puzzle. It's, they frightened me because they had COVID, and then soon after, uh, the dormant cancer cell has spread. And I hope the scientists will do a lot more research to understand how this works. I have nodule in my thyroid. After I had the first bout, I saw that there's a small enlargement of the nodule. And then after the second bout, I went to check on the thyroid, and the ultrasound showed that the nodule has enlarged again. So these are benign tumor. But think about how, like, if you have active cancerous tumor, the inflammation from this virus, the inflammation that triggered by this virus, can very well do a lot of harm in our bodies. And there's two saying, right? People say we shouldn't just focus on vulnerable people, like protecting vulnerable people. But vulnerable people definitely need to be protected because they already have underlying condition that weaken their immune system. We need to protect these people to keep them safe because we want to see these people around. And of course, we also cannot normalize infecting healthy people because then healthy people will become unhealthy and they will develop chronic illnesses after COVID. And they all join the bigger population of, um, the vulnerable population. And this population is definitely growing. As our government is saying, we are in a chronic illness crisis. That's an emergency. And long COVID is part of that crisis.
Yeah, so true. I have heard many people say, like, we're all vulnerable, just some people are more vulnerable than others. And you bring up some very great points, especially around vaccines not always being enough. They're fantastic, to be clear, and we've even recently seen a study that may indicate that the mRNA vaccines help certain cancer patients with certain kinds of cancer live longer, which is a great boon in itself, and kind of in contrast to the way COVID can, worsen the situation for people with cancer. But as you kind of alluded to earlier, it's not always enough, especially if it's not a neutralizing vaccine. Could you
Yeah,
talk a bit about the importance of layering precautions?
vaccine is a great tool, but it's a pharmaceutical intervention. And as just like any other pharmaceutical intervention, some certain people, especially with underlying condition, might not be able to take the vaccine. Some people who are immunocompromised, they need more uh, booster. But some people who have autoimmune disorder, like myself, I think I I have severe side effect, which is called hematuria. So because I have IgA nephropathy, my uh, the production of these harmful antibodies cause like severe inflammation when the good antibodies fight the bad one, and it caused my kidneys to leak blood. And because of that, even though I am a vaccine advocate, like I take all the vaccine that's um, my providers asked me to take, but I would not. I can no longer take the COVID vaccine, and I want people to understand is that it is very hurtful to generalize the situation. Um, what we have right now, as you said, the vaccines are not sterilizing, not like the measles vaccines where you take the vaccine and then it gives you very strong protection. But these vaccines, the protection wane, um, and there's a window where you will get the protection strongest, but then afterwards you you don't get the protection, and you're very vulnerable to getting infected and developing long COVID. And like my case, I got vaccinated, fully vaccinated. I still caught COVID, and I still my case is a breakthrough case. I still develop all kinds of serious conditions following the infection and a booster. So I want people to understand is why we have to talk about the layer approach, because we need a lot of tools. This Swiss cheese model really work because when you have more people using all the different tools, it produce a stronger defense that protect the diverse population. We have to think of people as unique people. No one has the same immune system. And it's not people's fault that their body cannot take a certain pharmaceutical intervention. And there are people, because of sensory issues, they might not be able to wear a mask. But then let's talk about some other tools, right? And measures. If you have COVID, stay home. Nobody likes to stay home and isolate, but you must do that because then you're saving people from an outbreak. One person can start an outbreak. And my husband and I keep reminding each other we gotta test negative before leaving isolation. But we didn't just do one testing negative because we understand that COVID can rebound. And even though he has no symptoms, my husband has no symptoms. He rebound. After a few days, he tested positive again. And then he isolated, he didn't go to work, and he just stayed home. He worked remotely for 3 weeks. He tested negative 48 hours apart 3 times before he leave the home. He does not want his colleagues to get COVID. If we all do this, if we all do this minimal, inconvenience or whatever you call it, then we're going to save a lot of people's health. Our health is really precious. Young people need to think really deeply about their health because no one is going to care for you when you age uh, faster. I mean, some long COVID patients said even though they're in their 30 or 40, they feel like they are in their 60s, in their 70s. And some people lose memories. Like I lost memories. It was very significant initially after the first infection. I didn't know how to like find my way, to places that I visited very often. It was really scary. And I feel that I don't remember like when my husband and my son talk about, movies that we have seen in the past, I said to them, I don't know what you're talking about. I don't know any of these movies. I have never seen it. And even when they brought it, like describe it to me, I still say I've never seen this movie. He said we went to the movie hall and saw it together. And I said, I still don't remember. No matter what they said, they wiped out of my brain. And I'm a writer. It's really traumatizing for me to have this disability. And and the pain also made me suffer a lot as a photographer. I remember, like recently I went to see the long COVID specialist. He said to me, oh, millions of people are disabled by long COVID and they stop working. Um, they they do, a few minutes of exercise every week. I
Yeah,
said, okay, thank you for your advice. But in my mind, I'm not going to give up my work. I'm on a mission to expose the truth about COVID and long COVID. I started this after I saw my friend who served the front line died and left behind his wife and children who never saw him before he died. At that time, we have shortage of masks in New York. We were all awake every night here listening to the siren. And my friend And many of other friends serve the front line and they sacrifice their life to care for patients. And these heroes really inspire me that if we cannot do great things like them, we can do small things. And we need to keep going to support public health. And I'm actually quoting from Dr. Martin Luther King's quote. Um, it is a civil right issue. Public health is civil right because people who doesn't have the people who doesn't have insurance coverage or access to healthcare, those people suffer the most. Those people die, those people become disabled, and no one care for them. And as a society, we need to look out for each other. And if we can do something for other people, we should not hold back. That's why you are my hero, because I cannot believe how difficult it is to create a mass block in New York, and you did it on your own, and so many people supporting you, donating to your mass block, and it's such a privilege to be your colleague in this fight because I saw you work, I saw how hard you work, and we were together at the Pride fair for uh, organized by the ACT UP New York um, to spread the word about COVID and long COVID and asking people to wear masks. And I mean, even though our method, even though our work compared to, like we reached, I don't know how many people uh, might not make a dent in the population, but every effort counts. I mean, changes come from every one of us, and we need to keep trying. And I hope that our effort will inspire more people all over the world to keep trying to teach people about long COVID and help people understand the consequence of getting infected and infecting other people.
Yeah, and conversely, like this is why people like you and Ivy, who organizes the ACT UP Health Fair every Pride Month, are really my heroes and my role models. Because I see people like both of you, pushing through, chronic health conditions, long-term health conditions, to say, hey, this is too important. We really need to advocate for ourselves and for others to make sure that, fewer and fewer people go through what we're going through. And to that point, I would love to hear how you look at Mask Together America and what you've done, how you've been as successful as you have been with Mask Together America, because I am constantly amazed at what social media empire you've created with this controversial subject.
Yes, you're right. It is masking is a now a political subject, a controversial subject, but actually it really is a life-saving tool. It saves people's life when, especially as source control. If someone is sick and they wear a mask, it greatly reduces the viral load um, and protect vulnerable people. I mean, everyone's vulnerable, but we really need to stop the chains of transmission. And I want to talk about, Mask Together America's focus is quite different than other advocacy organization in the sense that we focus on the humanity. Other organizations, they have different goals and aim, and a lot of time I see that they talk about the science, but not so much about individual suffering. and individual's dream. We all have a voice. And I want to create a platform where that bring people together. And that's why after I heard about the death of my friend, I dug up my camera, which I haven't used for years, but during the pandemic, I decided to take the SLR out, and I said I'm gonna go to the street and take pictures of people wearing masks. I remember my son said to me, "You're not." I said, "Yes, I am." And my son said, "You're not. Don't forget, you do have an underlying condition that makes you more vulnerable than other people." And I said to him, "But I know I can do something, and I'm not going to hold back. And I need to go and interview people and help them have a stronger voice." And I also believe that if we all come together, our voice will be louder. Everyone can have their own social media account and they can be posting their mask portraits every day. But it's different when you create a collage showing all the mask selfies and mask portraits together. And that show volume. We can say that we have a population of people that want to advocate for prevention. In order to qualify for that statement, we have to visualize it. I'm a visual person. My background is creative. I used to work in advertising. And I have this dream that I will create this collage of people speaking out together, wearing our masks. Masking is a very visual symbol about prevention. That's why I strongly voiced my opposition on our government continuously promoting vax and relax in the past few years. Vax and relax send a wrong message because they show people gathering, hugging, with senior people during Thanksgiving because you got vaccinated, right? Well, it depends on when you get vaccinated. The immunity really wane very quickly, and people travel very far, and you can get infected on your way to see grandma. And if you're not wearing a mask on the flight, you can easily catch all kinds of viruses, not just COVID, but also, we should talk about flu. This year we have a very dangerous clade that's spreading in Asia and also Europe. Clade K for H3N2. We should pay attention to the fact that there are a lot of airborne viruses, and you can really ruin the holiday season by infecting all your family members. And so Mask Together America, come together, all of us. We have creative people, editors. Our coordinator, Karina, posts about her, dancing in a mask, even in a company. She's wearing her mask, doing ballet. God's sake, if anyone complains about wearing a mask, you will see that our member can do handstand, jump, any, like highly athletic people are wearing masks, and in the gym, Dr. Bailey, who's what is her account? I forgot.
I'm blanking too, but I'll try to put it in the show notes.
Yeah, I mean, we have role models on our team that constantly inspire ourselves, that we need to remind people that they can do these things to protect everybody.
Okay.
Um, I also want to share that we are one organization that follow long COVID patients since 2020. Some of the long COVID patients, uh, I interview people from all walks of life, including people that caught COVID, and they didn't get better. And some of these people got very, very sick and lost their job or disabled and have to quit their work for years. And that include Dr. Marjorie Roberts and Dr. Robbie Tamago. And Becky and Sarah Robertson. Some of our members who are long haulers really taught us all, what long COVID is since the early day. And so I guess, when you share the truth, you attract a lot of people who want to know, really what's happening and not, listening to all the lies that's spreading from all over the place.
Yeah, there's really a lot of what I call head in the sand syndrome, which has really become pervasive in a lot of places. I'd be curious, how do you deal with folks who, often outright say cruel things on social media in their denialism?
So I don't know how to deal with them. Initially, they frightened me and they get me very upset. I was even afraid of like sharing my own story because of these people, because they were doing that to us. But over time, for some reason, I think it has stopped coming. And also, initially it was really bad. And I remember some of our members step up to help us like block trolls. And some people suggested we should even make it a private account. And I remember I found Sharon Brown. Sharon Brown is a cancer survivor and a former healthcare worker. And she stepped up and said, okay, I'll help you kill trolls. And so she did a lot of hard work every day, like removing some of these accounts or deleting the horrible comments that can trigger, you know, um, anxiety in a lot of high-risk patients. Um, but she was telling me recently that that has, really died down. I think our hard work probably is coming together and started to have an impact on these people because I do think that, we all have a heart. And when these people understand that you are working so hard, as volunteers, that we're not gaining anything out of, this work, they started to open up their mind and heart to, I guess, like to see the humanity of this awareness campaign. Um, I hope that this will continue, and I hope that this will attract more people to join our movement and just to understand that, we love our country. We want people to stay healthy. We want businesses to strive. We want the economy to be good and more people can find work. And we want disabled people to be cared for. And we want the healthcare system to provide for all. And all of this takes collective action. We need to take action together. We need to speak up together. And Mask Together America is a platform for people to do that. We all put our differences aside. We actually we don't really talk about our differences. And that's the beauty of it. Because when you start to talk about differences, oh God, it's going to be chaotic again. But we are very single-minded. We focus on public health, and therefore we can achieve something because even though this might be a very narrow message, guess what? We have to make a strong statement about this because otherwise, elected official, our government can easily remove, funding for important things like telehealth. A lot of states are losing telehealth. People, Medicaid, a lot of people, disabled people rely on Medicaid to get healthcare coverage, and they're losing healthcare access. So we must speak up together and fight for each other.
Yeah, and it really speaks to the power of the individual story, the fact that, Mask Together has America has had such a wide reach that's largely people telling their own stories about why they mask, why they layer up precautions, etc. Though I do think, and I'm so glad that trolls have been a lower and lower problem, but I do think we've also spoken about troubles with, some infighting, which, as you said, we really need to band together in so many ways. And what would your advice be for in terms of, what's constructive, helpful criticism and dialogue and what's not?
What do you mean? Can you say, like, explain what you're asking?
And so,
Okay.
obviously, we all often have disagreements within the masking community about what's the right way to go about masking and other precautions. And oftentimes, I know folks have expressed frustration with unconstructive, unhelpful comments on social media posts. And I'd be curious to hear your perspective on what is actually helpful dialogue versus what's just hurtful and divisive within the community.
I don't really know how to engage with people who ignore science because there are so many studies that have shown that um, air filtration can greatly reduce the risk of transmission and infection. And like HEPA filter and N95 mask, these work both like the same way in terms of filtering um, airborne viral particles. Um, Even though like, the actual, size doesn't really match up, but like you never see viruses alone. So they're like uh part of like all these uh liquid like secretion from our body, right? So um filtering our charged filters from charge filters and also like HEPA filter can get rid of a lot of these viral particles. It's really a very effective tool. And some people, even if you repeat the same information, they will still say this is a hoax and they show all kinds of memes. I don't really care about them. I mean, sometimes I look at it in a way that because like for social media, when you have engagement, you actually help to drive up the reach. So the fact that it's reaching the football stadium, getting these trolls to like wave their flag and uh, sharing to their friends and come over. It's actually a good thing. I don't mind that some people, I mean, you might not be able to reach like all of, like change their heart, right? All of them. But maybe one or two of them will start to see, oh yeah, my my child never get better after COVID and keep missing school and having all these headaches and GI issues and unable to sleep. So my child might be having long COVID. maybe I need to start to like pay attention to that. So you never know how the message reached these people on the other side. And initially, when I started this campaign, I was very upset to see no reach, no response from anybody. In 2010, 20, I I have posts that have like one like or zero like, and then for after a long time, one like, and I'll be like, oh, is this ever going to do anything? Because like censorship and government suppression really try to uh, not allow people to post anything about vaccination or COVID or masking for a long time, for years, during both administration. And I remember saying to myself, oh no, my effort is not going to do anything at all. And then there was people that are organizer for the Yellow Heart Memorial Group and also COVID survivor groups. These people lost their loved ones to COVID, and there are a lot of them, millions of them. And I remember one of the organizer, um, she said to me, "Don't forget if you actually save one life, could be just one life, but think about how you save one life. Isn't that monumental?" Like, and I was saying to myself, yeah. I mean, I always admire firefighters. The hard work that they do. They jump into, we run into a building when everyone runs out, and they try to save people from the burning fire and the smoke. And whenever I see people in a stretcher, the EMT rushing them to the hospital, I get very emotional. These are heroes that save people's life. And yes, one life means a lot. So that's what kept me going. And that's why I've always say, if I cannot do great things, I do small things, small things. And I cannot look at the negativity, like how there might be, a lot of people coming onto attacking Master Get America and saying, you know, um, horrible things about us. I have to ignore them because my focus is not about fighting people. My focus and everyone on our team, actually across the US, as well as our supporters all over the world, our focus is public health. Our focus is about, spreading the word and hopefully saving lives. And hopefully, if we know any story that people actually wear masks and saw our warning and wear masks, start wearing masks in when they go to work and taking the subway, taking the buses, or flying to see their grandma, great, because that message could be saving lives. And so that's how we should focus our energy on, is to look at a campaign that can bring hope, a campaign that require all of us to work together.
Yeah, it really is amazing what you've accomplished so far. Yeah, one of the things I was thinking of was like, you'll see people who agree with us broadly about masking, but for example, I remember at one point Mask Together America posted a graphic, a really gorgeous graphic about like, okay, here's the level of effectiveness for different kinds of masks. And on the higher end was a surgical mask with a brace because that solved for the leakiness of the surgical masks. And, somebody commented to basically say, like, oh my God, how dare you put that high up on the list of effectiveness? And I don't remember how you responded, but I remember it was very diplomatic. Yeah, yeah, like, so what's your advice for dealing with that kind of thing?
Right. So we have people that love to create or promote gold standard. Um, Basically standard that, you know, only N95 or nothing. Or some people will say high filtration mask or nothing. Um, that's why I am very reluctant to talk about guidance because we must talk about the environmental factors and also the social factors where we need to understand everyone's limitation. We all have um, we have our own life and struggles. People need to understand that it it might be affordable to you to get like to have wear N95 and change your N95 every day. But there are people that are worrying about their next meal, people worrying about paying their rent, and people who are disabled and lost their job, struggling to apply for disabilities, people who are very, very isolated and cannot get help or even acknowledgement from their family members. Um, so some of these standards can be a trigger to them because you might be able to meet these standards, but not everyone can do that. And again, I want to say is how grateful I am to you that you have a mask blog that provide masks. But again, I want to say is mask is like buying shoes, right? It doesn't fit everyone. I'm sorry. Some people will say, "Oh, Julie, can you just tell us what mask you will recommend that I get for my, visit to the city?" And I'm like, hmm. First of all, I don't know. I mean, it takes a long time for me to find flow masks that fit me. Like you can see. Can you see?
Yeah, you look great in it, and I so love that you came to the interview with your flow mask.
I'm wearing my mask because I have my husband need the building workers to come and work in our apartment to install some uh, like plugs for the heater, and our apartment can get very, very cold in the winter. So I want to reduce the risk of catching anything, especially I'm on a mission now. My mom fell recently and broke her other side of the hip, and so she is in a rehab. And I'm planning to drive to um, Massachusetts to see her. I don't want to get sick because that will ruin my trip to see my mom. And I mean, I never want to get sick for holidays, but especially I have to see my mom, who's extremely vulnerable, uh, over 80 years old, and have dementia. And so I need to take care of my families. So I don't want to risk getting an airborne infection. And viruses spread in the air and stay active in the air, especially when carbon dioxide is high. The level of carbon dioxide is high. So when people go out in crowded mall, to go shopping, please wear a mask because that will protect you and save your holiday time. Like you really want to enjoy your holiday, you don't want to get sick. It really is not fun. And then, like a few months later, you develop these horrible long COVID condition. I mean, I passed out a few times this month. I want to explain to you what that means because a lot of people will say dysautonomia or autonomic dysfunction. Okay, these are words that lots of people don't understand. But what it is I went to my aqua therapy uh, session to treat my pain because I have, this severe inflammation that comes and go every night, and they are very debilitating. So I need to go to therapy in order for the therapist to help me um, literally swing me in the water to loosen all the joints. Now, when after all the exercise and put me in a lying position and swing me and help me massage my neck and all the trigger points, she has to put me back in a standing position. When I change position, my blood circulation dropped, the pressure dropped, and I blacked out. I literally blacked out, and afterwards had headache and also heart. My heartbeat went like racing. People need to understand COVID has this power to change your um, blood circulation. I'm not a doctor. I don't, I, lots of people will say, you don't know what you're talking about, but I can just tell you is I blacked out. Okay. I blacked out when I tried to change the standing position. And people said, you have POTS. Well, guess what? I don't know if I have POTS because I'm seeing a cardiologist and I'm getting also like, I'm part of CORE, CORE, which is the Cohen rehabilitation for chronic illnesses. That's a Mount Sinai long COVID rehab center. They evaluating me and did like tilt table tests and all kinds of like breathing tests and evaluation. No one is confirming that I have POT. Same for ME/CFS. I asked them, I have pain, this recurring nightly pain attack me every night, and with my eye pain and dizziness, I cannot get diagnosed for ME/CFS. I have long COVID though. I have high index for long COVID. I score high for long COVID index, but I do not have ME/CFS. That's what they confirmed. MECF for you to qualify to have ME/CFS, you have to have big crashes, which is post-exertional malaise. I might get like tired after during the day, like working for a while. I do not get these crashes. Maybe down the road, if um, the autoimmunity or like bioprocessing continue to work up my body, I might get to that level. But I'm not there yet. I don't have a diagnosis for ME/CFS, but I have long COVID. And I believe that a lot of people are not in a similar stage as me, that they are infected by Omicron variant. As we know, lots of people are infected with Omicron variant. And I believe lots of people have long COVID after the infection with Omicron variant, except they are excluded from studies because of their medical conditions, as well as because the research index exclude them because they don't have certain symptoms that's on the list of these research index. And I believe that the research community, scientists need to do a much better job in defining long COVID. That's not excluding patients so that these patients will not have a hard time getting diagnosis and so that they can get targeted treatment and participate in medical research. Because it's not just getting sick, gaslighting makes everything worse.
Yeah, and to your point, long COVID can come with a wide variety of different symptoms that aren't going to look one exactly the same as the other. You know, what do you think would help in terms of getting, studies and medical professionals to recognize that one person's long COVID won't necessarily look like another person's long COVID?
Well, that's a fact. I mean, there are many root causes to causing these chronic illnesses. And the first step is they must not exclude autoimmune disorder that comes after an infection. As Dr. Cawthorne has explained, long COVID damaged tissues of our bodies and can trigger diseases, autoimmune diseases, which include diabetes, includes asthma, which are very, very popular diseases in the United States. So researchers cannot rule out people who develop these conditions and cannot say that they are pre-existing condition because people do not have these conditions before they were infected. They were diagnosed with these conditions after they had COVID. Same for cancer. COVID can activate dormant cancer cell. That's huge. I think people really need to start, researchers need to start to really examine inflammation caused by COVID. What is the aftermath of all this inflammation? Instead of talking about symptoms, but talk about the phenotypes, the endotypes, really examine the whole pathobiology of COVID and long COVID. And also isolate different organ system. How these information change people's organ system.
Yeah, thank you so much. And yeah, and to your point earlier about, it's important to wear your mask going out to the grocery store, etc. You know, both because, I hear so often like, oh, you should probably mask or test if you go to see grandma or somebody else who is vulnerable, but uh, there are going to be, vulnerable people in the grocery store too. We have the right to exist in the grocery store and go do our day-to-day chores and errands and such. But also to what you pointed out earlier, uh, you don't want to risk an infection for yourself, especially because even if you're vaccinated, which is great, you could still get it. And I believe there is some study or something that basically says each new infection has a compounding effect. So if you're continually getting COVID over and over and over again, that multiplies your risk in more than just like, well, yeah, it gives you more chances to get long COVID. It actually compounds the risk. Uh, do you have any suggestions or information on like the risks of getting long COVID with each infection?
I think one study showed that it doubled the risk of long COVID in children, right? If people get reinfected. Um, but I have a hard time believing in some of these studies. I find that they are all underrepresenting the truth because I I think it all depends on the cohort, like who do they identify as having long COVID. So therefore, I suspect it's like could be 3 times, 4 times uh, more. So that's why I have a hard time if people ask me, to show data and studies, and I would say, okay, I read all these studies every day, but I question them, especially after I participated in a lot of studies now, especially in medical trials for my medication, and also being a part of NIH Recovers authorship and participating in you know, studies that are being put together by clinicians and scientists and um, data scientists and patient representatives. I'm always questioning everything, the study design and how they created cohorts and how they analyze the data. And it's hard for me to really feel that you can trust what's happening and what's represented in some of these studies. And some of them, even if it's a year old, I think it aged very fast because now we have absolutely no infection control. People are not testing. People are not reporting. Government's not reporting. And HICPAC's gone. And people are not vaccinating. People are not wearing masks. So a lot of these, barriers to the virus gone. And the virus is spreading year round. And you don't know how people get sick and die. And so, like, I guess, and then looking at excess death, you can't really just say, okay, you attribute the excess deaths to uh, the ongoing pandemic. It's also, you can't do that either because we don't know what are the reasons that factors that's causing all the death. And also, like, that's why I was very keen on pushing people, scientists, to really come up with the correct definition and not exclude really chronic illnesses that happen after COVID.
Yeah, that is so important, and as other friends and I have said, like, do your own research, but do it the right way, know what's a reliable source, uh, you know, do be skeptical of some of the science, but don't just flat out say it's bad because it's coming from X or Y place. Look at like you were talking about, what are the constraints of this study? What are the complicating factors that might make it harder to get an accurate result, et cetera, et cetera. These are important things to think about while also saying like, hey, science is still great, you know. So before I take up too much of the rest of your time, is there anything else you would like to add?
I want to remind people of the humanity behind every mask. I think I want to share uh, uh, initially in 2020, I was writing stories and that are slices of truth of about the pandemic. And I started with meeting people on the street with my camera and featuring them. And one of the story I wrote was about this man called William Healy. He lived on the Upper West Side, and he used to guard the mask that was put onto Eleanor Roosevelt's statue at the Riverside Park. I remember meeting him, and he explained to me how every day he would sit by the statue to guard the mask. Initially, um, he was just trying to stop the prankers from removing the mask. He wasn't the only one that's interested in putting the mask on Eleanor Roosevelt's bust, but he was very dedicated. He was 75 years old, and every day, if the mask was off, like some other people removed it, he would have to get home, drove with a ladder, and climb up on the statue to put a mask back on. And he put this pride mask on the statue. I remember really touched by it, and I talked to him. I asked him why he cares so much about it. He said he got the mask from some passerbys in the park, and he wants to have the mask on Eleanor Roosevelt because he wants to send a message that we should uh, honor gay right everywhere in the world, and especially to honor his grandbabies, his granddaughters, and both of them are gay Black women. And so he was very, very proud of them. So he guarded the statue um, like a hawk. He actually has a nickname like the Hawkman because he fed the hawks in the park as well. Anyway, my friend died in December of 20, I think January of 2021. I met him in June 2020. And I wrote this story. And the other day when I was thinking about coming onto your podcast, and I wanted to share how I was inspired by lots of heroes in this world, and he's one of them. Um, and his dedication just to do this one thing, to guard the mask on Eleanor Roosevelt, um, really touched a lot of people's heart. And I want you to look at, the behind me, all the people that join Mask Together America movement and allow us to send a message together. There's so many heroes, unsung heroes in this pandemic that we have to remember. And that's probably a very nice children's book. We all think about all the death and sorrow that come out of the pandemic, but we also need to remember things that we learn, how important it is for us to support each other and care for each other.
Oh, that is so beautiful. And thank you so, so much for all that you do and for agreeing to give an interview for this podcast. Have a lovely, lovely rest of your day.